Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Charitable Home Care. Very glad you're joining us. However you may be joining us, we appreciate it very, very much. And I get really excited. I know I'm a little odd. I get excited when we get an update nationally about some things that are going to make a huge difference for a lot of people. Really excited that we have Charlene Rodriguez here to come and talk to us about that. Charlene, welcome back to the program.
Thank you.
I
Thanks for
appreciate
having
it.
me.
Of course, Charlene, the executive director of the Lafourche Council on Aging. And look, you guys do a great job of providing services and taking care of people. But we got some good news here
Yes, we
for
do.
Medicare, right?
Yes,
Tell us a little bit
yes.
about that.
Okay, and I'm gonna be reading off of this because I
Sure,
just got this
absolutely.
in today.
We'll make sure we get it right. Huh?
It says that some example Medicare is going to start covering more shots and things like that,
Right.
And vaccinations. And it says and now what's covered under Medicare Part D includes shingles, tetanus, diphtheria, and whooping cough, hepatitis A, and hepatitis B. You know, they were already covering flu shots, COVID vaccines, and pneumonia shots. That's still covered by Medicare. But these are some new ones that I just got in this morning saying that they would start covering it under Medicare Part D.
And again, I think people, if they're hearing this and listening, the really good news about this is that you guys service a risky population.
Right.
You serve people 60 and older
Exactly.
who are in need of service. This is a way for them to have coverage through Medicare Part D
Right.
for all of these vaccinations in addition to the ones that were covered before.
And it says they are covered zero out of pocket.
So it's completely
So
free.
What they were charging for before, yes, they're no longer charging. So especially shingles, because you know shingles is very expensive.
Oh, it really
And
is.
you have to get 2 shots. So
That's
not
right, it's the
everybody could
second
afford
shot,
it.
right,
That's right.
tier.
So now it's covered.
Yeah, covered and zero out of pocket.
pocket.
So for all of those. So if you don't mind, read through those one more time,
Okay.
Charlene, just so people who are just tuning in go, oh, Mom, Dad, you got to see this.
Right. It says shingles, tetanus, diphtheria, whooping cough, hepatitis A and B, which they already covered flu shots, COVID vaccines, pneumonia shots. They're still covered.
Right. And again, we learned over the last 3 years that some of these, with COVID, we've learned that if you've got a comorbidity, this can be very challenging.
Right.
And so it's always good to know that now these things are covered for people if they're worried about getting that. I mean, I will tell you, you and I probably both know people that have had some of these, but especially shingles, which is kind of a nerve-related
Right.
condition. It can be so painful.
They did tell me that it was very painful for that. So
Yeah.
when I got the age that I could get it, I promise you that was the first shot I went and get.
Right.
You know,
right?
because I don't like pain.
No, but none of
Pain
us
don't
do.
like
Yeah,
anybody,
that's
but
exactly
yes.
right. And so it's just so very important for people to realize that this is not, and this is something that's really good. You know, we always hear you and I dealing with the elderly, trying to help the elderly every place we can. We get cut all the time. This is a
Exactly.
situation where we're not.
Right, right.
Some
And I'm sure
extra
that we
services.
spoke last time too while I was here that with diabetes, the insulin now is $35 a month.
Right.
So that's a big help to them too. Now realize if you feel your diabetes medicine every 3 months, especially like the shots, you know what I'm talking
Right.
about?
Right. For the injection.
Then they're going to charge you a 3-month supply, like whatever 35 times 3 is.
It's right
you
about
know.
$100, right?
Right, a little over 100,
$105.
yes. So they'll charge you that for the 3-month supply. But if you get it monthly, they'll only charge you $35.
Right. And
which
then
that's
there's,
big
a
help,
cap
too.
on that.
Right, right. We also had some other things that I had seen earlier too that I wanted to mention.
Okay.
It says people with Medicare Part D now are paying nothing out of pocket for even more vaccines. Your Part D plan won't charge you a copay or apply to deductible for vaccines. And then it also says if you get a 2 or 3 month supply of insulin, your cost can't be more than $35 for each month supply, which I just told you that.
Right.
If you take insulin through a traditional pump that's covered under Medicare's durable medical equipment benefit, that insulin is covered under Medicare Part B. Those benefits go into effect July of 23.
Okay, so for those people that have to have a pump, and what that means is that somebody is requiring insulin delivered at
Right.
exactly the same time, and it's on a pump system, that is covered under Part B, and it's not even covered under D. So it
Right,
doesn't
exactly.
impact or affect your medication costs at
Right.
all.
And that's going to come into effect July of 23.
July of 23, another really good
Right.
improvement. All right, go ahead.
It also says starting April 23, you might pay a lower co-insurance amount for certain drugs and covered by Part B. If their prices have increased higher than the rate of inflation, the specific drugs and potential savings change every quarter.
Okay. So every
Every
3
quarter,
months
yeah,
about
it
that.
could change.
Okay.
If your drug cost is high enough to reach the catastrophic coverage phase in your Medicare drug coverage, you won't have to pay a copayment or coinsurance starting in 2024.
Oh my. So if you go through that gap, you won't
Right.
have to pay anything more in 2024.
Right.
That's awesome.
It also says extra help affording prescription drug coverage Part D low income subsidy program will expand to certain people with limited resources who earn less than 150% of the federal poverty guideline starting in 2024.
So some other things looking forward to if people can't afford their medicines, again, that's another option.
Right.
Okay.
Your yearly Part D out-of-pocket costs will be capped at $2,000 starting in 2025.
Oh my goodness. Because I
So-
know some that have been $3,000, $3,500, $4,000
Exactly.
for some people.
It
Okay?
says you also have the option to pay out-of-pocket monthly costs over the plan year
Okay. So
instead of when it actually happens.
Right.
So
Okay.
that way you don't have to come up to it all at one time.
Right.
So then they go on to say Medicare will select and negotiate costs for 15 Part D drugs in 2025. That's going to take effect in 27. 15 Part D drugs in 26. That's going to take effect in 28. 20 Part D drugs, B and D drugs, in 27. That's going to take effect in 29. And 20 Part B and D drugs, that's going to take effect 28 and every year thereafter.
I love the fact that they're looking at the future and talking about these tier 1, 2, 3, and 4 drugs, about what to do. Before we get into all the services and the wonderful things that you guys do through Lafourche Council on Aging, you need to know that there have been 2 different family members. Both of them specifically told me how easy it was to get resources through the Council on Aging. You just need to know that.
That really makes me happy. Thank you, Keith. That really makes me
You're
happy.
welcome. I mean, just your staff needs to know that they're doing a
I will
good
let them
job
know.
and helping people. So
Right.
speaking of, let's talk about how we do that. How does the Council on Aging really help these people? I know. I want everybody else to know.
Well, with the Council on Aging, we provide utility assistance. We help with low-income subsidy applications. If you're on Medicare Part D and you like low income and stuff like that, we could help you to get your prescriptions partially paid or paid all the way, or
Right.
like $3 to $10 a month instead of the whatever they pay.
Right.
We do food stamp applications. We do unmet needs, the medical alert buttons, transportation. We provide people to dialysis, which is a main life and death thing because you can't imagine the people who need transportation.
Sure. It's,
We provide
and Lafourche is so large.
It is.
that y'all are able to really take
Right.
people where they need to
Right.
be throughout the parish.
Exactly.
And that's such a long way. So
we do have good drivers, that do a great job. So I need to, kudos to all my staff, really.
Right.
Drivers get up at 5 o'clock in the morning to get the clients where they need to go, and sometimes they're on the road till 6 in the afternoon. It's not every day, but some
Right.
days. And we have homemaker services where right now in homemaker services we do have a waiting list. So we're
Right.
asking you please for your patience, unless you know somebody who's really interested in working and cleaning houses for elderly, tell them to give us a call because we're always looking for people. We also do home delivered meals. We have meals at our senior citizen sites, and it's all for people 60 and over.
Right.
And if you don't want to go to the senior site, we still are providing the drive-by meals. I did put it in my 4-year area plan, and hopefully, my area plan was approved unless they changed things.
Right.
We could still do the drive-by meals because right now in today's society, people are still working and they
Right.
don't have time to go sit and play bingo or enjoy life just yet.
Right.
So just being able to just go pick up a meal and eat it, would be
Is
fun.
very helpful.
Yes.
Yeah, and so you mentioned the Part D and the help with that, along with some of these changes that are
Right.
coming about. It really is going to make a difference down the road for people.
Right. And
with
we
the
do
Part D
see it
support.
because we have one center that a lot of people just do the drive-by.
Mm-hmm.
They don't want to come in the center and eat. They don't have the time to do it.
Right.
So as long as we could provide it, we will.
Right.
We also, like I said, the Meals on Wheels,
Right.
the home delivered
Home delivered
meals.
That's what people are kind of associate with the
Right.
Council on Aging. But that's why I wanted you to share all of those
Right,
things.
right.
And in addition, there's the commodities, right?
Right. We also provide commodities. We also have the medical alert buttons
Mm-hmm.
through the Acadian On Call and Lafourche Ambulance. We go through them for that
Right. And those are at a discounted rate.
at a discounted rate. Exactly.
Which is so very
Exactly.
nice because it's
Yes.
very needed.
Right,
When
right.
people don't know what to do, that
And if they're low
lifeline is
income and they're on food stamps, the Council on Aging pays for it.
pays for it
so-
completely.
For it, yes.
Oh wow,
yes,
okay.
yes.
If they're on the SNAP
right,
program,
Right. All
Right.
they have to do is provide us proof of that, and we'll pay for it for them.
Wow. See, again, y'all are doing a lot more than even some of the other parishes do,
Right.
which is really nice, and being able to provide those services.
Right, right. There was something else that,
It's my fault. I threw you off. I always do. But even it's one of those things I'm glad you mentioned while you're trying to think of that. Those drivers that get up at 5 in the morning sometimes aren't back till 6 o'clock at night. I think some of our residents need to know that they're working really hard to get you to and from your appointments. And sometimes you got to wait a little bit after
Right.
you've seen
That's a big
the
thing.
doctor.
Yes.
But they're working really
Right.
hard. And there are a lot of people that don't have to be working. You have some
That's
people
right.
that are kind of retirement age, don't have to work. They're doing that
they're
because they
doing that
want
on
it
their
for the
own.
community.
Exactly. And that's why we tell people, if you're diabetic, or even if you're not a diabetic, bring your snacks with you.
Yes.
That way you'll have something to eat while waiting, or bring you something to read, bring you a puzzle book, something to keep you occupied, because sometimes it may take longer than others.
Right.
And it all depends on where you're coming from. I remember what else I wanted to tell you.
It's my fault. I threw you off. Go ahead.
Homemaker services.
Right.
We do have a long waiting list for that. So Lynette, who's in charge of Homemaker, decided, well, what we're going to do now is to try to get as many people covered as we could. If we could do this route this week, skip it next week, do another route next week. And I thought that was an awesome idea.
What a
I
great
mean, we
way
can't
to
do that for meals, because people need the food.
Right.
But for house cleaning, you can, because, you're senior citizens, and a lot of people don't make a big mess.
Right.
So that way I thought that was an awesome idea, and we went with it. So,
Terrific. So stretching out that
stretching out,
resource
exactly,
to be
as
able to
much
do
as
that.
possible.
What a great
Yes,
idea.
yes,
All right,
it
Lynette.
was.
Good job right there. So again, one of those things, and look, it's just as people get older, it's hard for them to sometimes admit.
Right.
Let's talk about that process. For we as social workers in the field, we want to make sure that we're talking with the families about some of these services and resources. A lot of us give out the flyers, but you really want them to call. You really want
Right.
the family to call.
We really want the family to call, because a lot of times, I love the home health agencies. I love them to death. We work well with them.
Right.
Just sometimes the seniors don't understand what they're saying. I'm going to call them and get you these services. When we go to assess them, they say, I don't want that. I could do that myself.
Correct.
Now you have some of them with Alzheimer's who think they could do it all.
That
and
is
can't.
correct. That is correct.
So that's when you want a family member there with you,
Right.
to make sure, they're telling us the truth, because they have a lot of independence.
Sure.
And
sure.
they don't want you to take that
Right.
independence
They don't
away.
want that independence to be taken away. But I got to tell you, so we appreciate that. So it's a little bit about the referral process, a lot about what Medicare is being able to do,
Right.
and certainly. So last thoughts.
Right. Last thoughts is we're out on bid process right now.
Okay.
For baths, bathing. Let me think. Well, respite, yes. Respite, material aid, bats, 3B wellness. I know it's 3 of them. Wellness, material aid.
got 'em all.
That's it.
You got them all covered.
just thinking,
so bids are out for companies
Yes,
to be able to do
yes.
that, and so we look forward to those
Right,
companies
and the
being able
bids
to work well
are
with you.
due on May 3rd.
May 3rd.
Right. So if anybody didn't get a bid packet and would like one, they could contact the council on
Reach out
Aging.
to council.
Right.
Very good. Charlene, thank you so
Thank you
very
so
much.
much.
I appreciate your time. All right. And that will do it for this particular segment. Don't go anywhere. A lot more right here on HTV.